We're delighted to have with us Professor Dr. Sharif Sarky, Professor of Surgery in Qasr Al-Aini Faculty of Medicine, Cairo University. Thank you, sir, very much for being with us. And I'm sorry for the interruption. You have such a very tight schedule. Our topic is very important today. As I said, diabetic foot can be considered as a fatal problem. And as you told me that there is a procedure which has been used in other diseases, but now it's used to help people to avoid to be an amputee. Tell me more about this.
Diabetes can lead the patient to lose his limb in many different ways, and sometimes even his life. It's a very serious disease when it comes to speak about the limb, the lower limb. One of the ways is ischemia, that's blockage of the arteries so that the blood doesn't reach the foot. And eventually this may lead to gangrene and loss of the limb, and a real threat to the life of the patient. And another way, the patient may lose the sensation of the limb altogether. He doesn't feel the ground when he walks. And also have ulcers, sores in the foot, and infections. Sometimes the infection is overwhelming so that the doctor doesn't know what to do. And eventually he may resort to amputation, even in these cases. And in many other ways, the patient can lose the limb. The way I'm treating my patients is not new. It's an old way.
Before going to the treatment, sir, first, why some diabetes are living their life as ordinary people, unfortunately, of course, as ordinary people, and why there are others who can reach this fatal point which can maybe threaten to their lives?
This is an excellent question. You know, recently they found that the main issue, the main problem that leads to all kinds of complications in diabetes and makes the life of the patient a living hell is the prolonged periods of lack of control of the blood sugar. You see, this is a very important point in producing the eye problems, the heart problems, the foot problems, the kidney problems. So if the patient is keen to keep his blood sugar level at a reasonable level for long, then he is in a way, and he is not close to have these complications. But if he is negligent and leaves his blood sugar to be elevated for weeks, then he is subject to all these complications, including the diabetes.
This depends on the readiness of the body, for example, to receive the treatment and to be coping with the medication itself. I mean, of course, with its effects and side effects, or the age, or the diabetic's kind, if it is genetic, if it is acquired after the 40th age, for example.
Diabetes affects all kinds of tissues. It's not just a mere elevation of blood sugar.
Even if it's genetic,
even
if it's after the age of 40, in any age.
Diabetes is a syndrome. It has too many factors to consider. So these all cause damage of the tissues.
Sports, for example, can prevent this from happening?
In a way, sports helps the patient to control his diabetes. Yes, some exercise may help.
The way of life can prevent this from happening?
Sure. Walking, exercise.
Getting up early, sleeping early, fresh air. Living in an unpolluted area, for example. Of course, this is a dream, but I'm asking.
If we can, if the patient can do that. It will help.
Unfortunately, all these elements are not found, and the patient has reached this point, whether to have the treatment with injection or to be an amputee.
No, we can't say it like this exactly. You see, there are so many conditions in the foot that can be treated simply. There are so many conditions in the foot that can be aborted before they cause problems. That's why the patient self-examination every day is very important. Every day, before sleeping at night, the patient should examine his own foot and to discover a tiny scratch, a little wound, a little ulcer, a little redness, swelling, something like that.
This is not aching?
No, just watching the foot with a mirror or something like that.
I mean, this is not painful?
If it's tiny inspection. The problem with these patients is that they don't feel the feet.
Simply, you're talking about cancer, for example. It's something which can be considered as silent, and then it's shouting.
Yes, you got the point, bullseye. You see what? The problem with diabetes is that it goes on silently for years. While the limb is deteriorating slowly, and one day,
this is eating slowly or swallowing.
No, it's getting the foot starting to get ready for a disaster.
Why I have the impression that you are talking about is this, which can be considered more dangerous than cancer.
Yes, in a way it is more dangerous.
Yeah.
It's more frequent. We have 4.5 million diabetics in Egypt. Half of them at least have problems with their feet.
Wow.
This disease affects more frequently people in 40s and 50s in the zenith of their productive life. And this is the time when a father wants to help his sons. They has a big family, and once he finds himself unable to work.
Yeah.
And this has social implications.
Sure.
It's a serious problem.
Sure. Reaching the treatment. To what extent do you think that it's successful and all patients can benefit from it?
The kind of treatment I'm doing proved to be successful in different patterns of diabetic foot.
Yeah.
Diabetic foot has patterns.
Yeah.
You see, when the patient presents with the problem of that he doesn't feel the limb, that is, the medical term is peripheral neuropathy, inflammation of the nerves.
Yeah.
The patient doesn't feel it.
Neuro, it means nerve,
pathy
disease. Okay.
And it's peripheral in the foot.
Yep.
When the patient presents with this, I can treat him in 5 days.
5 days?
And this is the most serious starting point for diabetic foot.
5 days?
5 days.
Okay.
And they start feeling the foot in the 3rd day, and by the 5th day they become close to normal. Yeah. When
patients are coming from the countryside or from the towns. I mean, it's rural areas or in the city, which are, I mean, more affected with this.
No, it affects all kinds of people. The rich
all kinds of people.
The rich and poor, the old and the young, and all. I have seen all kinds of people.
Men or women.
Yeah, the same. Yeah.
Kids.
Yeah, the kids rarely. Yeah, because diabetes needs some time to destroy the basic metabolic system of the foot before what I call the disaster occurs.
Yeah. The examination which you advise your patient to do daily, exactly how and when he or she discovers something like that, what should he do?
Well, I have a booklet for the patient describing how to examine their feet. But simply they can watch key points, redness, swelling, scratch, an ulcer, something like that. And when they see this, they have to report to the doctor. Because they can't prevent the problem before it gets ugly.
Yeah. But you know, this is very... I mean, I was very happy when I heard it, when it's only 5 days.
In one particular type.
In one particular type?
Yeah, sometimes I'm not exactly amenable to this treatment. I have to be very cautious in telling you about this, because some problems like infection takes a week or so for control. Sometimes the patient with ischemia, you know, that is a blockage of the arteries. Yeah. Sometimes it doesn't work at all.
Then you were forced to decide to get rid of this.
Anyway, in all cases. I encourage all doctors to do this because it's so beneficial.